Good afternoon and a very warm welcome to our NEXUS webinar this afternoon. My name is Jaya Calder from Highlands and Islands Enterprise, and before I pass over to my colleague Katrina, I'd just like to spend a minute on how we can actually get you involved in this webinar. If this is your first time using GoTo, or if it's been a while since you've been into one of our webinars, you're automatically put on mute, but we absolutely would love your involvement, and there's a couple of ways you can do that. You can see that you have a question box, and at any point throughout the webinar, please type in your question and we'll keep them for the Q&A. And then if time allows, we have an opportunity to take you off mute, and you'll see what looks like a raised hand icon. So please just click on that. We are very keen on knowledge sharing and sharing a lot of the messages far and wide after the event. So we're recording today's session. I'd just like to pass over to Katrina now to formally start our webinar. Thanks.
Thank you, Jaya. I'd like to welcome everybody to today's NEXUS webinar. I'm Katrina Ramsey and I work as part of the Northern Innovation Hub team at HIE in Inverness, and I work with Andrea and the Life Science team. And one of the projects that we coordinate is the NEXUS co-working space, which is located in Inverness campus. And this is a space where life science companies and technology companies work together and collaborate in the space. NEXUS is funded by Inverness City Region Deal and the European funding. The NEXUS webinar series is a great opportunity to find out more about what's going on in our life science, health and technology companies locally and to make connections. I'm delighted to welcome Alan White, Director of Highland Health Ventures, and Alastair Williamson, Chief Executive of Wyld Networks. They'll be discussing their technology trial in an Inverness care home setting. This technology will allow relatives to visit their family and to help monitor and alert social distancing between visitors, staff and residents inside the building. This will be a big step forward for families visiting their loved ones in care homes. They are the first in Scotland to trial this access and monitoring technology, so it'll be really great to hear more about it today. Alan will talk us through the project and Alastair will provide us with more information about the technology. I'll pass you over to Alan, who will start things off.
I'm Alan White from Highland Health Ventures. Also, some of you will know me wearing my other hat as Interactive Health Limited. We're tenants in NEXUS, so I know some of the NEXUS tenants will be listening in, joining us today. What we're going to be looking at today is particularly a project that we're working together with Wyld Networks to take geofencing into Castlehill Care Home in Inverness, just up the road from Solasta House and the Inverness campus. And Alastair is going to take us through the use case that we're working on at Castlehill and how that will actually help to enable people to visit loved ones within the care home setting. And indeed, this whole partnership really in some ways came about because of colleagues who were losing their relatives, their elderly relatives, actually to COVID-19. So this is something that's very much touched us personally, as I know that it will have touched some of you too. A new alliance in digital innovation. I mean, Highland Health Ventures enjoys a close collaboration agreement with NHS Highland, which enables us to help test bed new technologies in the NHS Highland area. And this is originally how the alliance came together. And we're developing concepts, one of which is the Care Home Alliance, the geofencing within Castlehill. But the same technology can be used elsewhere other than health and social care. There are applications within tourism, hospitality, education, and transport. Now, all of these areas are experiencing difficulties in actually getting back to working effectively in the new normal that we're experiencing and likely to continue to experiencing for a number of months to come. So what I'm going to do first of all is hand you over to Alastair, who'll take you up to speed with what we're doing in Castlehill. Then I'll come back and talk about a few of the other projects that, along with Wyld, Highland Health Ventures are looking at within the Highlands. Alastair?
Okay, thank you, Alan. I've just got a few slides I'd like to take you through, which really just talks about what we've done, what is the innovation, and most importantly, how is it actually going to help with the remit that was given to us. So I'm going to talk about the use case that's specific to care homes. So very simply, what we're doing is we're combining a mobile application and geozoning technology to help reduce the spread of viruses such as COVID-19 and also influenza, with the remit to protect residents, staff and visitors. And there's 4 key bits of functionality that support what we're trying to do here. The first bit is access control. So our solution's being developed to provide that access control into the care home. So before you come to the care home, have a look at providing access control based on health status and policy. And I'll take you through each of these 4 segments separately. The second piece is obviously fairly obvious, and that's about how we use our technology once you're inside the care home to look at how we monitor, measure and alert on social distancing. And the third piece is more to do about how do we add value to this app. It's all very good putting out technology that has some functionality in it, but a lot of people, download apps when they actually see additional value to them. And so we've built into this solution a network for messaging so people can message each other. We've built in guest book log facilities so people could actually book appointments in care homes. And we've also built in a safety check-in facility for staff and visitors. The last piece is all about reports and metrics. It's obviously very important. So the solution allows you to actually generate reports and metrics, and that's all based upon compliance to be able to demonstrate that you actually are, as an organization, putting in place practices that really would help reduce the spread of contact viruses. So I'm going to take you through the access control piece, and this is a screenshot of our Fusion platform, and most of the presentation will take you through the actual tool itself. So just to explain what fixed geozones are. So fixed geozones are virtual walls that surround the care home. And now you can see what we've done here. We've actually put 2 geozones actually surrounding a care home called Castlehill in Inverness. And so what happens is once you enter that care home and you've got the app on your phone, the app is activated and all the smartphones that actually are inside that geozone will all be connected together without the need for Wi-Fi or 4G. Now, that concept of connecting smartphones directly together without Wi-Fi or 4G is one of our core capabilities, and we're taking that capability and implementing it into the care home facility. As you enter into that geozone, an access control process starts. So what it does is it basically wakes your app up and then implements a risk assessment based on policy and your health status to make a decision as to whether you can enter that care home. And obviously, because all the smartphones are connected together, you're actually part of a network and you can be messaged as to whether you could enter that care home or not based on your health status and risk assessments. One thing to be clear about is once you actually leave that geozone, then your app falls into sleep mode and you're actually disconnected from the mesh network. So it's probably easier trying to sort of explain this as a bird view of how it actually works and explaining these fixed geozones. So you can see there's 2 geozones in blue and red surrounding the care home facility. There's another one in purple, which has basically been created for sensitive quarantine areas. So in this schematic, I've shown the residents in yellow, staff in blue, and visitors in green. And as you can see from the left-hand side, as they move into the geozone, their smartphones are meshed together, and the risk assessment process actually starts. And I'll take you through what a risk assessment actually is. And based on the output of that risk assessment, you're given a message that allows you to enter into the care home or contact reception, or let you know that you can't enter the care home based on the policy that's been implemented at that point in time. And you can see the person in red down the bottom left corner. He'd be actually given a message, or she'd be given a message saying, unfortunately, you can't come to the care home today because of your risk assessment. Now, all of that risk assessment stuff is actually pre-done before you actually get to the geozone, and I'll explain that in a minute. The blue lines that are connecting all the people together, that's actually the mesh network, and that's actually connecting smartphones to smartphones without the need for 4G or Wi-Fi. You've probably noticed that the residents in yellow, that they don't need a smartphone, so they probably won't have a smartphone. So what we've done is we've equipped them with Bluetooth and LPWAN wearable lanyards or bracelets that actually create a similar effect, and I'll take you through how that technology works as well. So the risk assessment, and this is part of the dashboard that has been deployed, and the risk assessment allows you to do different types of risk assessments for staff and guests, risk assessments for different types of viruses, for COVID or for influenza. And the output is a traffic light model. It's red, you shouldn't enter; yellow, please go to see reception; green, free to pass into the care home. Now, the risk assessment is actually made up of certain questions that you would answer prior to going to the care home. In actual fact, you'd probably answer them on your app when you're actually logging an appointment using our app to get a time slot to go into the care home. And the questions are based on policy. The policy is usually driven by government, but the simple questions are, have you been vaccinated for COVID-19? The answer is probably going to be no at this point in time. Have you been tested negative in the last 24 to 48 hours? Have you been tested positive in the last 14 days? And then there's a little questionnaire that was developed by the Oxford University that is a little algorithm where you put in various symptoms and it'll come up with an assessment as to your health status. So that's all inputted into the risk assessment, and the output of the risk assessment is the traffic light system, which is messaged to the people when they get to the Geozone as to whether they can enter into the facility or not. So obviously today it's an input of trust from visitors and staff. But what we're doing is to move it away from a trust-based input process into a validated process. So we're in discussions about how we actually integrate our solution once the NHS roll out a digital vaccine certificate, and how we can actually integrate that into our app. And obviously these digital vaccine certificates will become the new currency moving forward. And so we then move from a trust-based model to a validated model where we'd actually integrate the app into the NHS database, validate whether the where you have a vaccine certificate or whether you've been tested negative or positive, and then we become more validated than trust-based. So the social distancing, so that's just now moved into the care home, and the social distancing is all about monitoring, measuring and alerting, and I'll take you through a couple of slides here. Here's a dashboard that is part of the solution, and it's creating heat maps, and it's a heat map of first floor. There's 3 staff, 10 visitors and 1 resident there. And the heat maps, I'll get to in a minute about how we actually use them. But now we move from using what I've called fixed geozones. We now move into dynamic geozones. And these are dynamics, fairly obvious. They're geozones that actually move with you. And so we create these 2 meter or 1 meter plus geozones that surround both the staff and the visitors. And they dynamically move with the staff and the visitors as they actually pass through the care home. And the output of this, and I'll get to how we integrate the residents with this in a minute, but the output, once again, is based on policy. So the output could be either an alert or a message to your phone to visitors and staff who are probably inadvertently infringing upon the 2 meter or 1 meter proximity over a defined period of time, whether that's 10 minutes or 15 minutes. So you can alert them, you can message them, but obviously that becomes quite annoying, particularly in the care home environment where you've got staff that are providing personal hygiene care to residents. You don't really want to be beeped all the time. So one of the things that you can also do, which is very, very important, is extract data. So we extract data from the network, and that data creates these heat maps. And these heat maps are in real time, so you can see them moving through real time. But it creates a history and it creates a pattern. And we use these heat maps to make decisions on the layouts of the building, so layouts of buildings that inadvertently don't allow for social distancing. We can look at routines, so that at 12 o'clock, if people are going for something to eat, you'd probably see some red zones in areas you wouldn't want to see red zones, so you can look at changing the routines. You can look at occupancy limits. The whole concept of the heat maps is to use real-time data that you can visualize and then action upon to actually change infrastructure, routines, layouts, occupancy limits to reduce the amount of proximity interaction that's taking place. And what we're doing now is moving to, that's great. What we want to do, and we're working with the NHS, is to how do we then integrate that data into the NHS test and trace process? Because obviously we want to know if there's an outbreak of COVID, who has been in close proximity with somebody for a certain amount of time over a certain proximity. And we can take that data, which is obviously fully anonymized, and then integrate that into the NHS test and trace process. But once again, if I try to sort of try to explain these dynamic geozones, and this diagram, I'm going to take away the building from this diagram, the floor plan, so you'll just see the people and the dynamic geozones. So there you go, we've taken away the clutter. So now you can see we've got the staff in blue, visitors in green, and the residents in yellow, and we've created these 2-meter geozones, dynamic geozones around each person. You can see where those geozones are actually overlapping, and they generate they would generate either an alert or a message if that's a policy, or they would generate the heat map, which is obviously very, very important. And so that's how the heat maps are actually generated. The blue lines are the communication channels between people. But when it comes to the residents, we're not expecting residents to be walking around with a smartphone with an app on it. They don't need to. We actually create what we call pseudo-dynamic zones by actually having the residents equipped with wearable lanyards with Bluetooth and LPWAN connectivity, and they also allow you to register proximity with other devices. The third part is about adding value here to the app. We want the app to be useful. It's very useful to do social distancing and providing access control, but we want the users to basically have a better experience. So we've built into the app messaging, we've built in safety check-in, we've built in a guest logbook. And because we've connected all the smartphones directly together in this mesh network without the need for 4G and Wi-Fi, we've created a network. And so we've got a messaging platform. So, staff can message each other, staff can message visitors. I've got some examples in the dashboard of, what's the lunch today? There's a spill on the first floor, or today there's a film at 2 p.m. So you can message people within the facility and also outside of the facility if you're on Wi-Fi. So it creates a messaging platform for staff and visitors. We've also built into it a safety check-in facility, and that safety check-in facility is all about ensuring that your staff and visitors are safe when they're actually on site. As I said before, the messaging facility works when you're meshed together inside the care home, but if you're a visitor and you go back home and you're back on Wi-Fi, you'll still get access to those messages that are obviously relevant to you. If I look a bit more about the messaging and the safety check-in piece, so I've got some screenshots of the mobile app there itself, and so you can see the messages that I broadcast earlier, which was a first floor spill and what's on the menu today for lunch. But also, as I said, we've built in this safety check-in facility. So, if there's a fire alarm, you can broadcast a message to everyone that has an app on the handset to basically say, please let us know whether you're safe. If there is a problem in the care home, you can broadcast these messages. And if you need assistance, if a staff member needs assistance or a visitor needs assistance, you can press the need assistance button. And then automatically on the guest book page, which is the picture on the right-hand side, which is in Fusion, you will then get a visual understanding of where that person is, so you can go and actually provide them with assistance. You can also use that the other way around. If you're a staff member or a visitor and you need assistance, you can basically activate that from your handset, and that will provide information to the dashboard that's run by the operational team in the care home, and they will get visualization of where that person is and obviously go and provide that person with assistance. But also what you can see there on the right-hand screen is the guest book facility. So we've built into the app the ability for visitors, when they're sat at home, to look at what slots are available in the care home so they can book a slot to come into the care home. And we know there are rules and regulations about how many people can go into the care home at one time and how many hours they can stay both indoors and outdoors. So you can, from your home, basically get access to the logbook, find out what slots are available and book that slot. And obviously at the same time, you'd obviously form your health status check and then make your way to the care home and go through the access control piece to get into the care home. The last piece is compliance supports and metrics. So, this is through our dashboard again, we can create all of these reports. And these reports are based on health and safety specifications and standards. The Care Home Commission have got their own requirements for compliance documentation. So we use the dashboard to create guest logins, social distance metrics, contact logs, communication reports, and safety check-in facilities. And it allows the care home administrators to basically provide that level of compliance that they may need to provide to whatever authority is looking for that compliance, and also create reports themselves to look at how they can potentially improve the facilities that the care home provides. So that sort of gives you an understanding of how the solution works. But I also wanted to touch base a bit upon what we're also looking at integrating into the end-to-end solution. So with Alan from HHV and ourselves at Wyld, we're collaborating with a company called Agilis, who provide a rapid on-spot testing solution. And we're integrating that capability into our end-to-end process to add more value to the access control functionality. So this is a rapid on-spot testing. It's a 20-minute test. And it's not just applicable to our applications in care homes, because, in the end-to-end solution, we have a lot of other applications, from football stadiums to businesses to conferences, and Alan will take you through some of these. But it also allows us to incorporate our complete end-to-end solution with a rapid on-the-spot testing capability. I'm about to pass it over to Alan now, but I thought I would just like to spend, if you don't mind, just a few seconds to, well, first of all, to thank HIE for inviting us to the webinar. Also want to thank Alan and HHVL for all of their support, and also the NHS in the Highland region, who've been incredibly supportive in really pushing us forwards to come up with a solution that's going to help them moving forwards. And just another thanks also to the developers in Wyld who've actually developed this solution. Just to give you some ideas, there's 450,000 lines of software code that are actually being used to create this solution. So there's a lot of software that's been written to develop this solution. So I want to thank them personally as well. But sort of giving everyone an idea of where we're going moving forward, we are looking to start the mobilization of the solution in the next couple of weeks. And we're engaged with the NHS in various regions. We're part of the NHS procurement solution that's in place for these types of technologies. We're engaged with private care homes as well, not just in Scotland, but also in England and also in the Nordics. So there's a big demand and there's a big rush towards us to sort of come up with solutions. And one of the great things about this solution we've put together is that because we've come up from a sort of policy-driven perspective, the basics are obviously very similar, but the policies allow different countries, different regions and different care homes to implement their own policy when they want to roll this solution out. So, Alan, if you don't mind, can I pass over to yourself?
Yes, thank you. Thank you very much, Alastair, for that. And again, coming back to the Highlands are particularly under the auspices of NHS Highland, our research, development and innovation, a very good collaborative area in which to test bed solutions like we've been describing, partly because of the geography, I think partly because there's a slightly smaller population. And here on Inverness campus, of which NEXUS is obviously part, there is a very collaborative environment that also helps us access support from NHS, UHI and HI, all within about a 5-minute walk of each other. So Alastair mentioned that I'd take you through some other applications that we're looking at, and they're pretty broad. One is tourism. Now, a project that we're already looking at, again in association with the NHS, is to look at an Internet of Things solution using the same basic technology, the geofencing technology, to manage the visitor numbers in the environmentally sensitive parts of Skye. And I think we've all probably seen the reports of excessive numbers of people visiting a small number of places on Skye. the same geofencing management system can help to mitigate that and essentially enable people to book slots or be directed on to other areas of interest that aren't anything like as busy. That same technology could be applied at a number of locations throughout Scotland, but also in areas in England, such as the Lake District in the southwest, the Pennines, just to name a few, but also we're already, as I think Alastair suggested, we're looking at solutions in the Nordic countries as well. Moving on to another opportunity is transport. Now, we're slightly humorously calling this Wyld at sea, but there's been reports of the economies of particularly the Isle of Arran and the Outer Hebrides, the economy suffering because limited numbers of people are being allowed in ferries. The same geofencing technology could be combined with smart ticketing to actually much more effectively use the available space on the larger ferries to enable probably not 100% complement of passengers, but significantly up it on what CalMac are able to carry at the moment. And there would be also an element of reassurance that people had actually genuinely been socially distanced on the voyage before they get off and start mixing with people on the island, because there's obviously a little bit of nervousness from the islanders themselves as to who and where are these people coming from. So it supports a bit of anxiety and stress that's experienced at both sides of that. Again, education is also an area that there's been a lot of concern about numbers of students on campuses and how we actually help students maintain social distancing. You know, again, a bit humorously, we're calling that Wyld on campus. We hope that students won't be going too wild anymore on campus, but the same technology that Alastair described would enable social distancing to be maintained. It would enable the universities themselves to plan a little bit better and to be fleet of foot or agile in how they adapt to, for instance, the hotspots that the system would identify. And it could enable students to get back on campus and to a near normal engagement with their studies. We're already talking to a number of universities, one of which is Hertford University in the south of England. We have been having conversations with some of the Scottish universities as well. And then finally, hospitality. We've heard a lot about hospitality. Hospitality and care homes seem to be the areas that are almost featuring most as having been affected by COVID-19. And how do we get hospitality back to work safely, enabling people to get back into pubs and restaurants and maintain social distancing, and importantly, help the people who run these venues maintain social distancing in a way that can actually get people back in and maximize whatever revenue they can generate and get back to some sort of normality while still living with COVID. We are talking to a group in Glasgow at the moment about that. And the total lockdown of pubs and restaurants in Glasgow just now has actually put those discussions a little bit on hold, but we're ready to actually go live with a demonstration as soon as we hear exactly what the new Scottish regulations will be. So we're working across a number of areas in applying the Wyld technology. And we think it's exciting. We think it's something that can go global. It's not only confined to working in care homes, but care homes are a priority for us at the moment. We can, I think, help, you know, particularly over the coming winter, we can help to get more people visiting their loved ones over the winter period, in particular coming up for the festive season, when people obviously are going to want to get back to some sort of degree of normality and being able to visit each other. Our system can support that and create a safer environment for doing so. So I think that's really as much as I think we want to cover just now. I think we want to hear from you. We want some questions, and I think we've got nearly half an hour in which we can respond to these. So I think over to the audience, please.
Okay, thanks. That's us on question time. Now, there is still time to use your question box and pop them in and send them to us. If we run out of time, don't worry, we will get back to absolutely everybody. But we've had some cracking questions in so far. So I'll just start, and if our panel can maybe take a couple of minutes with each of the questions, just so we can get through as many as we can. Thanks for our first question, which is inquiring about the order of costs for installation and ongoing operation of a system like this. Also, can you install it in southern England? And finally, how much support would be needed? For example, could the home operate it without your further support other than for upgrades? So if we could look at costs, location and support. over to our panel.
I guess I'll take that one. So the way, if we're looking at care homes and the way it's costed in care homes, is that the model that's been adopted is a cost per bed per month. And it's a model that's been quite well used in the care home market. So that's the model that we're adopting. You know, it will be a few pounds per bed per month as an offer to the market. The second question was, part of the question was, can we install it in the south of England? Yeah, absolutely. I don't think we've got any geographical restriction, and probably to add some cadence to that answer, we are, I guess we'll be announcing it in the next few days, signed up resellers that will take us into the global market. We realise that Wyld's, you know, we're a growing company, but we need the resellers that are really part of the healthcare environment to take our solutions into that market. So we'll be going through a reseller partner agreements with several resellers globally. And I think the last piece was about how to ensure that, you know, that this is a hands-off solution. So it really is a solution that is very simple to use. You know, that the app can be downloaded, very simple download capability, put the app in place. Running the dashboard is very, very simple. So there's training that will go to the care homes to allow them to use the dashboard so that they can operate the system per se. Generating reports is simple steps to do so, but we'll put training in place. I think obviously when it comes to upgrades, the upgrades are automatic. So, you know, automatic, when we push out an upgrade, it will upgrade everyone's app, it will upgrade the dashboard solution. So we really have developed this with an eye to try and reduce the amount of contact that's taking place. And we have a hashtag, which you may have seen, which is #contactlessworld, and that's been one of the drivers to developing the solution.
Thank you very much. Okay. Our next question, I've got a couple of questions that are around about the same area, so I'll combine them together. The first one is, are you planning to incorporate rapid point of care testing so that if someone turns up not having had a test, can they be tested on the spot? And similarly, the next question, I'd be interested to find out more about the risk assessment questions the app asks visitors to the care home. Does it take into account a person's health conditions, or is it only focused on the risk to staff and residents from potential viral infection?
So I'll answer the first part of that question. The answer is yes. We are working with Agilis to incorporate the rapid testing facility into the overall process. And in respect to the second part of the question, which relates to the risk assessment, so it's a brilliant question. I think if I understand the question right, the risk assessment has to work both ways. There's a risk associated with people coming into the home, which obviously I explained earlier on. And then there's obviously the risk of, once a visitor comes into the home, that they could potentially catch a virus. So the second part of that is basically taken care of by the care homes that have their own policies in respect to whether they would allow visitors into the care home based on the risk assessment of the care home facility itself in basically transmitting the virus to visitors and staff. And that's totally down to the policy that the care home, or potentially the local government or the government itself, will put into place. So I hope I answered that question right. I'm more than happy to go through that question again later on and get back to it if that was not how it was put.
If I could chip in there, Alastair, I think it's worth reminding our audience that the installation at Castlehill is still test bedding. It's a pilot, and we will learn from our experience there, and things like the risk register, the risk questionnaire can be modified as we go during that test bedding period.
That's great, thanks. Now, for the people that asked those questions, if you'd like to follow up on that, then please use your raised hand icon. I'd like to ask you now a technical question. What happens to the mesh network in case of a power outage? And also, what impact does the app have on the smartphone's battery?
So also a really good question. So the great thing about a mesh network is we don't actually need power. It needs smartphones to have battery power on them. So, you know, the electronics that are put into the care home, or what we leverage within the care home, are people's smartphones, so they have their own battery power. There are some beacons that are located, some Bluetooth beacons that are located in the care home, which actually enable the proximity calculation for the residents, they're Bluetooth beacons. They're about the size of a 50p coin if they still exist, and they're battery powered. They're very low energy devices, and they have a battery power of about sort of 5 to 6 years. But what we also do, so they don't need power, but obviously the fact is if a battery does go on one of these Bluetooth devices, these Bluetooth beacons, 4 years or 5 years, whatever it is, that's the issue. So part of our solution, which I didn't show you, is we actually monitor the actual battery life of the Bluetooth beacons, so we can see at what point in time that we have to send Joe Bloggs along to go and actually put a new battery into those Bluetooth beacons. So to answer the question, we don't have an issue in respect to a power outage.
That's great, thanks. Now I'm going to change it up a bit and we're going to come to our audience. And I'd like to come to Jeff and take Jeff off mute. And Jeff had previously asked a question around about visitors and risk assessments. Hello.
Hi. Yeah, I wondered if I could follow up on the question about the risk assessment. I'm the resident troublemaker, I guess. From the point of view of you kind of answered it, Alastair, but not quite. What I was really thinking of was there's maybe an opportunity, but also a question from a user here. So if there are people who have health conditions which potentially mean that they can become more seriously ill if they contract COVID, and also things like flu. So I'm thinking of things like asthma and if they've had chemotherapy for cancer and stuff like that. My personal interest is diabetes, but I'm wondering whether the app enables those people to also do a risk assessment to them of them going into the care home to see whether they would actually want to apply for an appointment. That's the kind of thing I'm thinking of. And if you're looking at the other applications of it more widely in terms of the pubs and on transport, and potentially I wondered about places like gyms, that kind of thing. I thought that might be quite a useful feature that you, if you haven't already got, you could offer, because it might be quite useful. I appreciate a lot of the sort of central decision making is around policy, but there's enough policy and evidence, clinical evidence from the NHS that I would have thought you'd be able to ascribe probability factors to these things. I told you I was a troublemaker.
No, you're not a troublemaker. Actually, I really like troublemakers. We only employ troublemakers at Wyld. So just to answer that question, so it's really good. So the risk assessment is built from ground up, and so you can change that risk assessment at any point in time. Now, the way that we've got it set up at the moment, there's basic questions. Have you been vaccinated? You know, fairly obvious, yes, no. You know, have you been tested negative in the last 24 hours, or have you been tested positive the last 14 days? And then associated to that, we have a self-assessment that actually uses an algorithm to actually give you an output of your health status. And part of that question, those questions, you know, that relate to, do you have a permanent or a cough, and a whole load of different questions, a fever, etc. But part of those that questionnaire actually relates to your underlying health status. It relates to, you know, have you had a heart problem? Have you had? You talked about diabetes. You know, we can add that into there to basically create. I don't think we've got diabetes in there, but it does ask you for your underlying health, any underlying health issues you may have, that you could input into that algorithm to give you a view on whether you feel that you're even safe to go in and apply for an appointment at the care home. But coming back to it, because we've built it in a perspective allowing people to, or organizations, governments, care homes, to build their own policies, you can actually take that health status, that self-assessment health status, and add in any questionnaire you would like to, and have the algorithm provide you personally a view on whether you would go in or not. So yeah,
I as a user could do that, could I?
Yes, you could.
I think that's quite an important feature from a promotional point of view. That would make it quite attractive to a lot of people.
Absolutely. And as I say, because we can build it from the ground up, you know, we can add to that self-assessment questionnaire to, you know, allow you to input any further data. So
very good.
There's an algorithm that's developed by the guys at Oxford University, and I can't remember the names of the chaps, but yes.
Okay, thank you very much. That's really good.
Pleasure.
Jeff, thanks very much. It's always a welcome addition to any webinar. Now, before I come to John to take John off mute, I've got another question around about there are fast antigen POC tests coming online soon. Can your solution adapt if the test types change?
Yes, if I can qualify that. So we're working with a company called Agilys, and they have a range of test solutions. And what we're looking at doing is integrating their rapid testing solution into our process. Okay, so it is standalone but integrated into the process, in particular the onboarding process. We will engage with them further in respect to further integration, which would probably be integration into their dashboard, because they would have a dashboard as well. And that's where then we start to do some further work in integrating that into a dashboard, and then it's further down the road. But in reality, we're integrating their capability into our process, and we're taking that out across multiple opportunities, whether they're care homes, football stadiums, whatever. The great thing about the partnership with Agilys is that, you know, they've got relationships and with a lot of, you know, football stuff and music festivals and that type of venues. And, you know, we have the association with those environments as well, but we also have the healthcare piece. So we're just bringing the two parties together. Hopefully that answered the question.
Could I come in and just play devil's advocate here a little bit on it? Is the football stadiums, events, conferences, the cost factor isn't really that important in terms of people taking an on-the-spot test. I think regular visitors, we've got to be very cautious and very sensitive to appearing to be levying almost a tax on family and friends visiting loved ones. I think casual professional visitors to the home, that's a different thing. I think we've got to be very cognizant of sensitivity around cost, or pushing costs up for visitors. So I think if that is part of the solution, we've got to be very conscious of cost in that area.
Thanks both. Now I'd like to see if I can come to John, to take John off mute to ask his question.
Hello.
Good afternoon. Hi.
Hi. Question for Alastair. Alastair, obviously you guys have done a fantastic job in developing a solution for the care homes, but as we can appreciate, this solution obviously isn't restricted just for care homes. I can presume it's obviously going to be used, you know, whether it's for football stadiums or it's for concerts or it's for the universities or schools or offices and stuff. How do you intend to deal with the demand? Because I'm sure once your prototype is confirmed, you know, you're going to be totally inundated.
Yeah, we already are, John. And, you know, we looked at this probably about 10 weeks ago. How do we deal with demand when it really sort of turns into a bit of a tsunami? And our business model really, and HHVL is a partner of ours, but we are signing up a lot of other partners in the healthcare space that will be basically taking our solution to market for us, whether in the US, Asia, Japan in particular, by the way, and Europe. In Europe, we're looking more at the Nordic countries first, but really it's about getting qualified resellers and system integrators to take our solution into the care home market or into the stadium market. You know, if we look at the different markets, there's a lot of them, and so we really will be. We've signed up some companies, and we're signing up more, and we'll be announcing them over the next few weeks. And each of these guys have all got a particular, each of these companies have got a particular focus, whether it's in industry, so that's getting businesses back to work, enterprise software solutions, once again, helping smaller companies get back to work, whether they're in the manufacturing space, whether they're in the sports space, and whether they're in the transportation area. So we will build that capability through these resellers to address the market. And what's important is they're also able to support this capability. And they're also able to get to the market a lot faster than we can.
Well, Alastair, as you know, it's John Mattani, one of the largest shareholders of Turn, who's made me very, very happy today. So thank you very much for that, and good luck with your delivery.
Hello, John. Yeah, thanks very much. And yeah, thanks for your support, by the way. I do appreciate it.
Pleasure. Take care.
Thanks, John, and thanks to the responses there from our panel. Now we can have time to squeeze in a couple more questions. We've talked about data. Can you clarify if the data from risk assessment stored? Is it stored? And also, is this a GDPR issue that needs user and resident consent?
So a really good question. So the data that's it's collected is anonymized to start off with. We've gone through the whole GDPR process, not only just as Wyld, but also with all the people that we've been talking to. So the answer to the question is that GDPR compliant consent is required when you download the app, by the way, because when you download the app, you'll be requested when you download the app to enable some location capability, but that's the same for every app that has location capability. So that's the level of consent that you would have to provide in downloading the app. And in respect to the data, to say it's fully anonymized, fully GDPR compliant. And as I said earlier, the only consent that you would have to provide is when you download the app is to allow the app to basically become active once you walked into a geozone. Now, just to remember is that one of the really nice things about our solution is that, your app doesn't actually wake up per se until you actually walk into a geozone, okay? So when you walk into the geozone, your app connects and you're connected together in a mesh network. Once you leave the geozone, you're disconnected. You're gone. I don't know you. Obviously, you can use it outside of the care home when you're sat at home on Wi-Fi, but you use it just as a messaging platform or to book an appointment in a care home. That's it. You're disconnected once you leave the geozone.
Yeah, can I chip in here, Alastair, just to add a little piece on what we're going to be potential, or what we can do with the data. We are collecting some really rich real-time data that is GDPR compliant. As Alastair said, I think that's absolutely critical. It is anonymized data, but we're already in conversations with the Scottish Chief Scientist's Office about how the data that we're collecting can actually influence government planning around how buildings are set out, how policies are developed in terms of maximising systems like ours, not probably only ours, there will be other systems out there, but how our system can be maximised in a building to give real reassurance around social distancing and essentially help people to get back to some sort of normality safely.
Thanks very much for that. That was great. I'm going to squeeze one more question in before I pass to my colleague, Katrina. And it's around about the app's interactivity with sensors. So can the app interact with sensors, for example, to locate equipment, check for emergency equipment, consumable stock levels, etc.?
Yep, absolutely. So one of the, I didn't bring it up in this set of slides, to be honest with you, but what the network does is, we connect smartphones to smartphones directly, but we also connect smartphones to IoT devices in a mesh network. And we would use a Bluetooth capability of an IoT sensor. So in the hospital environments where we're creating mesh networks of smartphones to smartphones, we're also connecting hospital beds to the network. So you can then track where the hospital beds are. You can track, ventilator systems by connecting through IoT Bluetooth enabled devices directly to the smartphone. So we create a mesh of smartphones and a mesh of IoT devices, or better put, smartphones to smartphones, smartphones to IoT devices, and IoT devices to IoT devices. So we can enable that tracking of all of that equipment that, could potentially just get lost, and then give you the ability to visualize where that equipment is, to go and collect that equipment and sort of get it back to where it needs to be. So the answer is yes, and it underpins the whole philosophy of Wyld is doing, is people to people and people to things.
That's great. To both Alastair and Alan, in 30 seconds, each of your final message for our audience before I pass to Katrina. So Alan, final message.
Go, Alan.
I guess final messages. First of all, thank you all for giving us so much of your time just now. An hour's quite a bit out of a lot of people's day. Final messages. Look, this is, I think, great technology that can really help us get back to normal. Spread the word, please.
Thanks. Alastair.
I wish I'd gone first because I was about to say the same thing. What I'd like to say is that, in as much as we talked about the application in care homes, that's very, very important. And we really are going to, we're doing this. There are personal reasons why we pivoted from what we were doing pre-COVID into doing this. And, this is very important. It's personal. And we really, hope that, everyone on this call, just help get the word out on what we're doing, particularly in care homes. But let's not forget that we also now need to ensure that education gets back up and running. We need to make sure business gets up and running. Someone has to pay for this. I'm not talking about Wyld, I'm talking about our whole COVID situation. So we really need to get back to some semblance of normality. And I think what we've got is a solution that can help. And thank you very much for listening to me.
Thanks very much to both of you. Now I'd like to pass to my colleague Katrina Ramsey for another couple of slides and the final thanks. Katrina.
Thank you. I'd like to thank both Alan and Alastair. That was really interesting. And it was great to hear more about the geofencing technology and the progress that's been made in the Inverness Care Home for the trial, but also clearly it's going to be the way forward for a lot of businesses, like you were saying, and also for the universities. And that's really exciting. So thank you very much for going through that with us today. I think everyone will have found that really interesting. So thank you to everyone who's joined us today. We're looking for your feedback. So please do fill in our GoToWebinar feedback that will happen when we close the webinar off. And if you would like to be anonymous, we've got our SurveyMonkey questionnaire that you can fill in. So please do share the recording with anyone that you think would be interested in finding out more about this. And join us for our next webinar, which will be taking place at the beginning of November. We'll have Gavin Neat joining us. He's the founder and CEO of Neatbox, and he'll be discussing how technology is positively helping disabled people through his apps Welcome Me and Button. So it'll be another really interesting webinar. Keep an eye out for our invite on our emails and also on social media, and we look forward to seeing you then. Thank you.
Thanks very much, everyone. And as Katrina says, we look forward to you joining our next webinar. Have a good afternoon. Bye-bye now.